I'm Zafar and I'm the Chief Information Officer for the Liverpool Women's Hospital and the Alderhay Children's Hospital. Both hospitals are based in Liverpool in the United Kingdom and are part of the National Health Service in the United Kingdom. The reason why we looked at putting in single sign-on solution for the Liverpool Women's Hospital was because we had multiple applications that our clinical staff were logging into, and for each different application they had to remember a different username and password, and the passwords that they had to remember had multiple lengths and multiple combinations of letters, words and numbers. And what we were finding was that they just couldn't remember those various combinations. On average, a clinical person at the Liverpool Women's Hospital has to remember 10 different username and passwords in a given day. The problem with that is if you cannot remember, you have to call the help desk to get that password reset or for them to give you the password. The other issue is it's a massive clinical risk. If you cannot log into a clinical system, you cannot treat the patient effectively. After selecting the OneSign platform, we bought 2 appliances and a user license for 1,000 users for the Liverpool Women's Hospital. The implementation of the actual system was fairly straightforward. We used professional services from the Imprivata team in addition to one of my technicians working in collaboration with them to roll out the agent to all the machines, and installation of the hardware was fairly straightforward. We initially contracted to deploy or profile 10 applications, and that was done in a matter of days, so it's probably been one of the easiest deployments I've seen. Since the deployment of the OneSign platform at the Liverpool Women's Hospital, what we found is a decreased number of help desk calls. Prior to installation of this platform, we dedicated one person, one whole-time equivalent, to just answer these calls on a day-in, day-out basis. The issue not only being financial, one person can cost us a lot of money just to reset passwords. The bigger issue is that person would go mad just answering those calls. It's not an effective use of a person's time, and it isn't the best job in the world, and people don't like doing that kind of work, answering help desk calls for resetting passwords. It's also been more efficient since we've been able to deploy this, because I've been able to redeploy that person to a more meaningful, exciting job. When we looked at the various vendors that were providing single sign-on solutions, what appealed to me around the OneSign platform was its ease of use. It was just an appliance. It was an appliance that you put into your network. If you wanted resilience, you put in a second appliance. Those 2 appliances could be geographically dispersed for disaster recovery, and it was a very simple application to use. The technicians told me that when the applications were being profiled with this particular product, it was very easy to use and configure, and it was more or less running itself. And that's our model: keep IT very simple and not have a lot of resource thrown at maintaining or monitoring a system. So looking at this architecture, it seemed like at the time it was the most innovative and easy to implement. One of the primary reasons for selecting the OneSign platform for us as an organization was around the clinical systems that we use within the organization. Our primary healthcare information system is Meditech. It's a Magic Platform version 5.6, and we found that Imprivata were the only people at the time who were able to integrate it into a single sign-on solution for us, which was key for us. Other clinical applications that are running on the OneSign platform include GE systems for PACS and obstetrics, and the actual integration work to get the clinical applications working for us literally took just a day. If I had to put one word to what I feel around the OneSign platform, I would say innovation. It's a highly innovative product, very simple to use, very easy to manage. The future plans I have as CIO for both of these hospitals is to implement the OneSign platform at the Children's Hospital, which is an additional 2,000 user implementation. In addition to this, the Children's Hospital at Alderhay is a 98-year-old hospital, and we have plans over the next couple of years to build the first European Children's Health Park, which will be a 300-bedded hospital, which will be what I would coin the hospital of the future for us. an intelligent hospital, an intelligent building that has identity management at its core, a building where the users walking into the building will be known by the building, and settings for heat, light, temperature, logging into systems, authenticating into systems will be known by the building itself. And that's what we plan to build over the next couple of years.